Hello, my name is Maria Escobar, and I'll be informing you about general basic information. Thank you, Mr. Ted, for coming in tonight. Today, I will inform you about two types of diabetes, the risk factors, the signs and symptoms, and treatments. That at least one person from this audience, that is my purpose, for you to take into your home with this knowledge. And if you do have any symptoms, go seek a doctor early as possible. Imagine living with the silent killer disease and not knowing at first you have it. If you do not control it on time, it can impact your daily life. This disease kills roughly 79,000 lives yearly. With a show of hands, do you know of someone that has this disease? My mother and I have this disease in our family. Therefore, I will walk you through the signs and symptoms you need to look out that might pertain to having diabetes, the lifestyle changes that you might need to do to accommodate, the doctor routines, and just to live with diabetes. It's manageable. To begin, we will go into the signs and symptoms you might have with diabetes. There's no symptoms affiliated with diabetes, but there are some early signs that you might have and or feel, and that pertains to diabetes. And that is having numbness, blurriness. You might urinate more often, increase of thirst, hunger, fatigue, and some people even lose weight. The way to check if you have sugar levels, high sugar levels, is by doing a blood drawn, and this test is called A1C that your doctor recommends for you to do. Once you do it and you come back that you do have diabetes, it is mandatory or is required for you to take it every 3 months and go see your doctor, and he will read off the numbers, your sugar levels in your blood, and if they go up or down. And from there, he could increase your medication or decrease it. I could show you quickly how do you check. This is the other way, your daily. You're gonna check your blood. There's a glucose machine. You need a test strip, and you need the lancet. Basically, you just get the strip, you insert it, it turns on, and then with this, you pinch yourself, and blood will come out. You get it, and a few seconds, you will have the results. And it's a bit high because I just ate dinner, but as soon as I drink my medication at night, in the morning, it will be normal. It will be fine. You will experience some tiredness and some numbness in your face if you do have diabetes. But if you don't pay attention to these simple little signs, you will end up in the hospital. Being diagnosed with diabetes can be overwhelming, but with a managed diet and medication, it can be controlled. There's two types of diabetes. First, diabetes occurs let me walk you through how diabetes is. Diabetes occurs when your body cannot efficiently use your own insulin, your pancreas. The hormones in the insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either does not make enough insulin and cannot effectively use the insulin, as a normal person can do it. If you have 100 milligrams, what is showed here, in fasting, then it's normal. If you're fasting and it has more than 126, that is considered not normal. And they will tell you to do the HC1 test to get it, to verify, and this could lead that you have diabetes. There's two types. So type 1 is pretty known as juvenile diabetes, or child diabetes, and this commonly used with the treatment with insulin. So insulin will be your treatment, your daily dose, and this is not reversible. You're born with it. You get it as a child. Type 2 diabetes, mostly common. About 90% of people, adults, have it, and that's because they're overweight or they're healthy, their eating habits are not good. And the treatment is with pills, metformin or glipizide. And if it's not controllable, then it will go into insulin. So you could also do small walks, do some exercise, control your stress, and this would moderate your sugar levels to be low, normal. If you do not take your pills on time and it's uncontrollable, if you get like a foot injury or something, it could lead to cangreas. That's no poor blood circulation. I seen it myself. My stepfather got it. Started with the toes, then his whole foot, until he passed away. But it is controllable with a healthy diet. The doctors have classes that help you with controlling your weight and healthy meals. So in conclusion, I always go to the doctor and get checked up. If you feel any symptoms, you only know your body. Please, if you have any symptoms, go in. Diabetes is not painful, but it is tied up to high blood pressure and cholesterol. And if these three things act up, it's like a ticking bomb, and you just will explode and end up in the hospital or even dead at once. So please, just do not prolong any days longer. Thankfully, my mom has managed her diabetes for 25 years, and I have managed mine for 6 years with a healthy meals. Thank you so much for attending.